Good evening. This is Dr. Jagannathan. Today, I have planned to talk something about fatty liver disease. Fatty liver is a condition which prevails commonly in most of the ultrasound abdominal findings. When somebody takes your ultrasonogram of abdomen, most of the time we get fatty liver. So people are all sometimes worried, sometimes astonished. What is this fatty liver? What is going to do with my liver? Will it affect my health? All these questions always arise in the mind of the people. So I thought I could say something about the features of fatty liver. Fatty liver is also known as hepatic steatosis. Steatosis means liver. Fat. Fat is called a steaton. So steatosis is fat in the liver. It happens when fat builds up in the liver. Having a small amount of fat in the liver is expected. All of us have small amount of fat in the liver, but too much can become a health issue. In most cases, fatty liver does not cause symptoms until late stage. In the initial stage, most of the people, even though they have fat in the liver, it does not cause any much of symptoms. But if you have symptoms, they are likely to be vague. Just like most of the other diseases, fatty liver does not have a defined symptoms, definite symptoms. So the symptoms are vague, like abdominal pain and fatigue. Treatment of fatty liver depends on the type and the severity of the fatty liver disease. We are going to discuss about the type and the severity. So depending upon the type and severity, the treatment modalities will be changing. But the most important thing is lifestyle changes such as a balanced diet, more exercise, limiting alcohol and reduction of weight reduction. All these things will help to have a healthy liver and getting rid of fatty liver. The liver is the second largest organ in the body. It helps to process nutrients from food and drinks, isn't it? Because so many digestive enzymes, so many other materials that all produced from the body, from the liver, they all assist in our digestion. Too much of fat in the liver can cause liver inflammation. So, I want to tell one thing. Nowadays, any disease, either a heart attack or a stroke or diabetic nephropathy, whatever it is, everything starts from inflammation. Inflammation is the primary culprit. So, accumulation of fat can cause inflammation in liver that we call it as hepatitis. Fatty liver develops in someone who takes a lot of alcohol. So, the commonest cause of fatty liver is alcoholism. The fatty liver due to alcohol is called alcohol-associated liver disease, other called ALD. ALD, alcoholic fatty liver, is called ALD. In people who are not alcoholic, there are situations where they can have fatty liver. That is called metabolic dysfunction associated steatotic liver disease. It's called MASLD. This is not alcoholic fatty liver. This is something called non-alcoholic fatty liver. Commonly we call it as non-alcoholic fatty liver. Now, we essentially we have one is a alcoholic fatty liver, other one is non-alcoholic fatty liver. Now, what are the symptoms of fatty liver? That's very important because fatty liver can progress through some stages. When somebody gets fatty liver, if it is progresses and the fatty liver is not controlled, fat is not controlled or not treated, it may progress into the last 4 stages. One is called fatty liver, then is called steatohepatitis. Fatty liver is accumulation of fat in the liver. Then it's called hepatitis, steatohepatitis, that is inflammation of the liver cells. Then that is fibrosis. The liver cell is soft mass that becomes fibrous tissue. That's called fibrosis. And the last one is cirrhosis. Cirrhosis, all of you know, the whole liver shrinks into a mass of fibrous tissue. So these are the 4 stages of fatty liver. Whether it is ALD or non-alcoholic cirrhosis, they present similarly. However, many cases of fatty liver have no noticeable symptoms. That's the most important we should remember. Fatty liver is most of the time is diagnosed sonologically. Only when you take an abdominal scan, you find there is fat in the liver. People may be more likely to notice symptoms during the later stages of fatty liver, including cirrhosis. For example, when you have fat in your liver, you have a fatty liver, you may be totally symptomless. You may not have any obvious or any troubling symptoms. So usually we don't bother about it, we ignore it. But once it progresses into the hepatic state, fibrotic stage and cirrhotic stage, and when you go into cirrhosis, you get all the symptoms, severe symptoms, and that will be fatal also. But usually fatty liver can cause certain symptoms that's like abdominal pain, loss of appetite, you may not have good appetite, unexpected weight loss, you will be losing weight, weakness or fatigue, nausea, that is sense of vomiting, itchy skin. You'll have when you have a liver problem, you may have itching over the skin. Then you have the jaundice, yellow color of the skin and the yellow skin and eyes, and you may have a patch of or a tissue beneath your eyes, xanthoma. This is called a yellow skin, that is called a xanthoma. Then we may have easy bleeding tendencies because liver is essential, hepatic function is essential to maintain coagulation. So you will have bleeding tendencies. Then you have high-colored urine. That is because of the bilirubin. See, when you have jaundice, you have high-colored urine. Then there will be a fluid accumulating in the body. You will have big abdomen, that is ascites. Lot of fluid, liters and liters of fluid will accumulate in the abdomen. You will have a pot belly with the fluid, not ordinary pot belly, pot belly with the fluid. Then you have swelling of the legs, edema, we call it edema. Both your legs will be swollen, and you may have certain clusters of blood vessels under the skin which will be visible. Then you have confusion. Lastly, you will have decrease in sexual function. So these are all the common symptoms. All of them are vague symptoms. They are not definite. They are not particular only to fatty liver. These symptoms can occur in other conditions also, isn't it? But early stage of fatty liver comes with all symptoms which are not vague. So metabolic dysfunction associated with steatotic liver disease, that is non-alcoholic fatty liver. If you have excess fat in your liver and no history of alcohol, you are not an alcoholic, but you have fatty liver. That is called MAS LD, that is non-alcoholic cirrhosis. So when you have non-alcoholic cirrhosis, you have excess fat in your liver gets inflamed, you have no history of heavy alcohol use. This is the picture of non-alcoholic fatty liver. So you are not an alcoholic, but there is excess of fat in the liver tissue, and also there is inflammation. But now coming to the most important, alcohol-associated liver disease, ALD, that is alcoholic fatty liver. Drinking a lot of alcohol damages the liver tissue, leading on to ALD. Alcohol-associated steatohepatitis is when you have a buildup of excess fat in the liver and there is associated inflammation. Not only fat is there is also inflammation, which is called alcohol-induced hepatitis. This is alcoholic hepatitis or alcohol-induced hepatitis. So, to diagnose an alcohol-induced hepatitis, you must have excess fat in your liver. The liver should be inflamed and you should be drinking excess alcohol. This is the picture of alcohol-induced hepatitis. So, now there is one more condition called acute fatty liver of pregnancy. During pregnancy also, due to hormonal changes and because of the physical change in the size of the uterus and the enlargement of the fetus, all these things can also meddle with the circulation to the liver, because the fetus will be enlarging, the uterus will be enlarging, that will be pressing upon the inferior vena cava, blood vessel, so that will affect the blood vessel supply to the liver, so that may also cause a fat accumulation in liver. We are not going deep into that. So that is one condition, acute fatty liver of pregnancy. Now, what are the causes for fatty? Apart from alcohol, how do somebody gets a fatty liver? What are the causes? First one is drinking too much of alcohol. Alcohol is definitely the primary culprit. And there are other conditions where even if you don't drink alcohol, you can have fatty liver. The most important thing is obesity. Obesity is one condition where there is an excessive fat accumulation all over your body. So that fat doesn't spare your liver also. So obese people, apart from having so much of fat all over the body, they will have accumulation of fat in the liver also. Next one is type 2 diabetes. See, type 2 diabetes, I told you, diabetes is one disease which does not spare any organ in the body. So, because of diabetes, you will have the damage in the blood vessels. Damage in the blood vessels cause inflammation. This inflammation spreads to liver also, and there is accumulation of fat also. So, type 2 diabetes also is a cause for fatty liver. Then high levels of triglycerides. Triglycerides, the bad cholesterol, that may also can cause increase, because triglycerides also a group of fat, isn't it? So when there is excess of triglyceride, that may also accumulate in the liver and cause a fatty liver. Then metabolic syndrome. There is one syndrome called metabolic syndrome, that is obesity, mixed segment obesity, diabetes, hypertension, dyslipidemia. All these things are group called metabolic syndrome. That's a medical topic. So if you have somebody has a metabolic syndrome, you will have fatty liver. Then some of the drugs can also cause, some of the drugs, they can cause fatty liver. Then some type of infections, liver infection, especially hepatitis C. Hepatitis C, there are three hepatitis: hepatitis A, hepatitis B, hepatitis C. B is very dangerous, C also is dangerous, that can cause a fatty liver. Certain rare genetic conditions. So there are some people, the fatty liver runs in families also due to gene. Then older age, old people, because they are sedentary, their food habits are changed, they are not adhering to exercise, all these things can cause fatty liver in the elderly people. Health conditions such as obstructive sleep apnea and then polycystic ovarian cyst. See, the PCOS. PCOS is very common in women, isn't it? It's a disease of women. PCOS, PCOD or PCOS, whatever it is, that causes fatty liver. It's a common cause of fatty liver. So these are all the causes other than alcohol to cause fatty liver. So now, how fatty liver is diagnosed? So we see, as such fatty liver usually diagnosed only with ultrasonogram, that is by abdominal scan. But a physical examination, when you palpate your abdomen, you will be able to feel the, doctor will be able to feel we will be able to feel the liver. We will feel the liver, we will feel the consistency, we will feel the movement. So that is a palpation, physical examination. There is a technique how to feel palpate and feel the liver. Now usually liver is not felt through abdomen, but when liver is enlarged, it is palpable. Then you got certain blood test. In the blood test, we measure the enzymes. All of you might be aware that we see when you do a liver profile, they say SGOT, HEBOT, ALST, a lot of enzymes. So there are a lot of liver enzymes. They are all responsible for metabolism. They are responsible for normal health. So they are all increased. There is an increase in the liver enzymes. Then we have to take an imaging test. You can take an ultrasonogram, you can take a CT scan, you can do an MRI scan. Then finally, you can take a liver biopsy. You can take a piece of liver and then you take the liver biopsy and put it in the microscope and actually visualize and see how much of fat is there, which type of cells are there, whether the cells are normal, whether it's inflamed, in the hepatic stage, or they are sclerosed, or they are cirrhosis. All these things you can see under the microscope. Now, coming to the treatment, how to control and treat fatty liver. So, the options are very minimal. First thing is stop alcohol. If it is due to alcohol, stop alcohol, limit alcohol, and you have to stop alcohol. Next step is you have to weight reduction. Weight reduction is most important. Third one is change your diet habits. That is lifestyle modification. And avoid certain medications and other supplements. Because nowadays we are taking a lot of medical supplements. See, there are two types of drugs. One is essential drugs. Other one is supplements. If you go to nowadays, when you go to a doctor, he gives 3 essential medicine and 7 supplements. You will have a list of 10 drugs, but the essential drugs will be only 3. The supplements will be 7. So, this is something to be regretted. This is happening. So, when you take a lot of medical supplements, a lot of medicine, that may affect your liver, causing fatty liver. So now, how to treat fatty liver. See, as such, I told you, treatment of fatty liver is only modification, because there is no drug to treat fatty liver. We cannot say that this drug will act on it. No drug is there. Still, even now I tell you, only weight reduction, change in diet habits, exercise, and be a brisk life, and completely avoid alcohol. Okay. And if you are diabetic, control your diabetic. If you have hypertension, control your hypertension. All these things you will take. Now the complication I have told you, it will go for sclerosis, and the final complication is cirrhosis. Cirrhosis of the liver is the whole liver has become a mass, a fibrous tissue mass, so totally out of function. Liver is a very, very important organ for detoxification. See, there are so many toxins are produced in the body. Most of them are detoxified. Detoxification is done in the liver, because excretion is done by the kidney, but the toxins are converted in non-toxin in the liver. So when the liver fails, all the toxins will accumulate in the body, and they will affect the brain. You will get a hepatic encephalopathy, and that is death of brain due to liver disease. So that will end in death. So the detoxification process of liver completely is mod in cirrhosis liver. So nowadays the ultimate treatment for hepatic cirrhosis is liver transplant. Now that is I hope that is some sort of vision at a distance, that even if you have a cirrhosis, you have some hope to regain your liver by a liver transplant. But it is, I will not say liver transplant as it's in the full-fledged stage. It is in the growing stage. So liver transplant can save people's life to a certain extent, provided it has got its own limitations. Any transplantation has got its own limitations. So the most important thing is preventing fatty. Rather than treating fatty liver or treating the complications of fatty liver, preventing fatty liver is most important thing. So now what are all the things you have to do to prevent fatty liver? First thing is alcohol. Limit all. If you cannot stop alcohol, limit alcohol. But stopping completely is the best thing. Maintain a moderate weight. Weight reduction is very important. Eating a nutrient-rich diet that is low in saturated fatty acid, trans fats, and refined carbohydrates. So, the culprits, liver-damaging culprits are saturated fats and trans fats. And these are all present in the most often the fast foods. We are taking lots of fast foods. So, the trans fats, the saturated fats you have to avoid. Then you have to take steps to manage your blood sugar. If you are diabetic, keep your sugar under control. And if you have a triglycerides, you keep your triglycerides under control, and have a watch on your cholesterol levels also, because this is a new concept. Cholesterol and triglyceride producing fatty liver is a new concept. So you have to focus on cholesterol levels and triglyceride levels. And then you have to strictly follow the recommendations for diabetes. I have told you, diabetes can affect any part of the body because diabetic first affects all the blood vessels. It causes inflammation and the atherosclerosis or the affection of the blood vessels is a cause for most of the disease. So control your diabetes, then increase the amount of exercise. The mobility, you have to improve your mobility and keep yourself active and by doing regular exercise. So these are all the points which I want to share regarding the fatty liver. Even though it looks a benign condition, ultimately it's a malignant condition. So we have to be aware of it. Thank you very much. We will meet with another topic after some time. This is Dr. Jagannathan. Have a great day.